Hi, my name is Jasmine Pope, and I am going to explain how to do an abdominal assessment and what I'm checking for. First things first, I want to go into the room. I want to wash my hands, perform hand hygiene, have the patient state their date of birth and their name. And I would explain to them that I'm just going to do an abdominal assessment. So after washing my hands, I put on clean gloves. I ask the patient to lay down in supine position. And before we do anything, we're just gonna look and observe with the eyes. So I would look from both sides of the stomach, just looking for any type of distension or raised areas, anything abnormal. I would then look from the feet up towards the head, and I would look for the symmetry of the stomach. Is it in line? Next, I would then, before auscultating, or even like during the initial observation or the eye assessment, I would just ask the patient if they have a history of any type of stomach issue, GERD or ulcers, anything like that. If they have problems with constipation or going to the bathroom. And then I would also take once I get the required information. I will listen to all 4 sounds of the abdomen, not moving until I note that there is an abdominal sound. I would then note to remember if it's hypo, hyperactive, or normal active. Next, I would kind of listen for any vascular sounds. If you go 2 inches above the umbilicus, there are aortic sounds. You can listen to the iliac arteries and the renal arteries. If you go 1 inch below the umbilicus and diagonal to the side, you can listen for any type of brewing or anything like that. You won't necessarily hear vascular sounds, but if you do, that's a great thing to know because that's not normal. From there, after you've listened to different sounds, you want to make sure that you palpate. And you're going to use the pads of the fingers, and you're going to go all over the abdominal area, checking for tenderness, pain. If there is a painful site, you want to save that for last. You just want to ask the patient if anything hurts when you're feeling. You want to go about 5 to 8 centimeters down. You want to put a little more pressure when you're feeling for things because there can be a mass or a lump or something like that. If there's no abnormal findings from there, you want to document, making sure that the abdomen is soft and round and that there are no complications or no pending problems. Thank you.